Hi, teacher.
Hi, Salome. How are you? Good
Fine,
afternoon.
and you? Good afternoon.
Fine, thank you. How was your
Nice.
day? Did Did you get to work?
I went yesterday a job and they told me that I have to go to January 20, but I am waiting for that. But at the same time, I am looking for other jobs in other hospitals. So how is start the year? Maybe have a answer for final in the final of January for starting in February.
Okay, so you have time to relax because you're gonna have a lot of work there before after that.
Yes, teacher. And these days are so cloudy. Like today, I got up like 10 a.m. because for the weather, I think that is early. And my dad came to my room and told me it's so late. Come on, get up. Okay.
But you can say I have to sleep. I I deserve it.
Yes, and after that, I help in the things of the house, and that.
It's pretty good. Sometimes we need a little time for us, and then we will have a lot of work to do. So
Yes.
best times maybe where we were relaxed and just take it easy. Everything
Yes.
is going to fit in her seat someday. Okay?
Yes, teacher.
Okay. So let's start the class.
Okay.
I will put you in a situation as always.
Okay.
I want you to think of an examination you
Mhm.
frequently carry out. Okay? And maybe you can tell me the instructions you will give to the patient
Sorry,
for
the last part
any.
I can hear you.
I'm sorry.
The last part I can hear you.
I'm sorry. You can give instructions to as if you were telling you to your patient in order to make them do what you want him to do. Okay.
Okay. Uh, whatever pathology.
Yeah.
Okay.
Any kind of examination you frequently carry out. I think maybe with children you're
Okay.
going.
With
If
the
you want.
children. Yeah. Sometimes when I am in the examination with child the most frequency that I do is about the if they to to comprove the if they have equilibrium in
Okay.
the things that they do or they understand the order that I say. So in that case, the currently that I say is cover the eye and walk for me, come with me, but cover your eye, and they do that. And
Okay.
so in this situation, we can see if they have first if they have equilibration. After that, they receive the orders, if understand the orders, and
Okay.
while the patient walk, we can see too the form of he walk or her walk. If he walk normally or he walk hard with um, if he step too hard.
Okay.
I have because sometimes the child make that and we have to correct that for avoid problems in their body.
Okay. Okay. That's very
Mhm.
good. Another kind of examination you frequently carry out.
Okay, the other situation where is I am in emergency, a specialty in the first care attention is about the appendicitis. So we have to say that the patient that he lie in the bed, in our bed of examination, and he flex the knee, and while he are doing that, we push the part of the, how do you say, the flank, flank right, that
Okay.
is at the niveau of the ombligo. Okay. And when we push that, if the patient have appendicitis, we we push and retire very fast, and he have to have a reflect to pain there. Mm-hmm.
Okay. Just a correction. Instead of you use equilibration, you can use balance. Okay.
Balance. Okay, teacher. Thank you.
And belly button is ombligo.
Okay. Thank you.
Okay.
Very good. Okay, teacher. Thank you.
Okay, that's pretty good. And then maybe in some kind of accident, I don't know how you. I think you are the first line, right? When the
Yeah.
patient gets to the hospital, so you have to tell them what he has to do. Okay, so how do you give the instructions for any kind of accident?
Okay, the most typical when we have accident, we have a Glasgow scale that we evaluate the patient with that scale, that have three parameters, and the one of them is the if the patient make uh, take the order that I say. For example, open your mouth or close your eyes. Very basically, the other part of that scale is the if the patient recognize the pain, the local pain. So we make a stimul in her body. It could be in her arm or her leg, and he have to say ouch, or maybe retire the part of the body in that part. Um, the other is if the patient are conscient,
Conscious.
yes, conscious, and know where is him, who is him, and what time or what happening in that moment.
Mhm.
That is the basic, but sometimes in the emergency case, uh, the most typical is you can the question like, you can feel this, or where are you, what happened. And if we have to examine all the body, we say, okay, can you open your arms, and can you show me where you to feel, where is the pain. If the patient have an accident, in car accident, maybe is don't move too much, please, for be sure that don't have any lesion in the column.
Okay, very good. I'm sorry, I cannot hear the last part.
uh, which part, until which part you listen, teacher?
Um, to avoid the column lesion, you
You
told
have
him that.
that don't move, don't the head have to be very focused on the red line to only to see an a specific point, and don't move until we can be sure that all the neck, all the column are okay and don't have lesions.
Okay. Okay, excellent. I think I have a little trouble with my internet again. So,
Don't worry.
so sorry.
No, don't
Okay,
worry, teacher.
we already talked about psychiatric examination, right? So, can you describe any case you have encountered in your professional career?
About psychiatric health. Okay.
Yeah.
Mm, t- uh, Maybe when I was in the Julio and Dara hospital, that is about really like a person who have a lot of problems of the a lot of problems with the mental, but really, really like serious. So one area that is for person that have problems, psychiatric problems, but are judiciales about the law, and always the policeman has to be there.
Okay.
Uh, and one day all the students have to rotate that, and when I was there for one day was scared, but the most thing that I was like shocked was about one was teenager that he looks normally like okay perfectly because he was taking the medication. He
Mm-hmm.
was good. So I took the his historia clinical history. I
Mm-hmm.
take it and I started to read, and I found it that he killed his mother with a scarf because he was really angry with something that happened with his boyfriend, because they were having relations, and he can be the his girlfriend stopped him like very strange, and she gone. And when he go to him home, the mother told him that what's happening, are you okay, and all that things. And he was so angry that he started to asphyxiate her with a scarf. And she said in the court when he was with a judge that he do that for only for an angry moment, but he want to stop. But when she watched that her mother was blurring for her noise, uh, he imagined that if he stopped in that moment, the mother will be with some problem in her head because he was asphyxiated her. So he decided that kill her mother, and that is, oh my god, I really shocked about that because he looks like normal.
Wow.
And I don't know, maybe I can him because was a teenager. I can know him some days, and I think that is normal. And but that was really shocking me. And until that moment, I started to be more carefully to when I know someone, because that is really that we don't know who is the person that we know.
Yeah, that's right. And I agree with you. Maybe that's why you can use some kind of examination,
Mm,
that they cannot notice, but you just can ask some questions in order to know what about her or his mind, right? Because
yes.
you don't even happen with people. Wow.
Mm.
So, what kind of questions you can use for that reason?
Maybe in one way, I only always ask about what is her father's or him father's or her father's, where it depends on a friend or boyfriend, because I think that the person how he explain how talk about her family say
Mm-hmm.
a lot of that person is. So that is one question. Sometimes I ask in a normal conversation, like, when you are sad, what do you do, or what usually you like to do when you are stressful, or how do you are conflicted when you are angry, or you need to your space to think, and after that talk. And that is depend all that answer that I say okay I will continue, or is okay is better than okay, only like friends, but really far, far friends.
Yeah, that I agree with you. Yeah, we have to have and be very careful with that things. And I don't know. Did you? I'm just asking. Did you speak with this guy, with this kid, when you
In when
you
I
have?
was there, yes, that was the reason that I took clinical history, because when I speak with them, he's okay, he's really relaxed and all was okay, but that is my curiosity when I see that it's normal. For that reason, I took that history. Hmm.
Understand? Thank you, Salome. I will send to you my little questionnaire, please.
Okay, teacher. Done.
And hello, Liz.
Hi, Liz.
Oh, oh,
Hi, teacher. Hi, Salome.
hi.
Hi.
Yes. Okay. Thank you very much.
Okay, bye,
Salome,
teacher.
see you tomorrow.
See you tomorrow. Bye, Liz. Bye.
Bye.
Hi,
Thank you.
Salome. Take care.
Hi, Liz. How are you?
Hi, teacher. Good afternoon.
Good afternoon. How's everything?
It's okay. It's okay. It's pretty cold today, but I think I am okay.
Okay. We're getting used to that kind of weather. Maybe sunny someday and then cold sometimes.
Yes.
Like
And is it
here.
still raining there?
No, it's so, I don't know, it's so crazy. Now it's hot here. Uh, I don't know. It seems like it's not gonna rain. I hope, but we don't know.
Yes, that's true.
Okay, Liz. Then I will put you in a situation again, as always. Okay. I want you to think of an examination that you frequently carry out on your consultation. Okay. Maybe you can say some instructions you would give to your patients for any kind of examination you are imagined to.
Okay. First of all, I will explain to the patient that I'm gonna examine it, the body. Um, so I will ask the patient to come to the medical bed I'm lying on.
Mhm.
First, mm, boca arriba.
Lie down with your head watching to the roof, maybe.
Yes. Um, and then I start with the head. So I'm gonna explain that I'm gonna touch the head, and if the patient if feels some pain or something that annoying, please tell me while I am doing the palpation. Then I'm gonna check the eyes. So I will say that the patient that don't move the head, only with the eyes, feel my finger side to side, right side and left side. And after that, I'm gonna check with the light.
Mhm.
So I will say, maybe this light is gonna make some annoying, but don't cause any pain. It's just a light. Um, then I will review the mouth. So I order that please open the mouth and say ah. Then I have to check the tongue and the posterior part of larynx.
Mhm.
Then the lungs. And so I will say the patient, please breathe deeply. Take some deep air and exhale. So that's the way that I can hear some sounds. Maybe if the sounds of the lungs are normal, or if I gonna find something that is not normal. Then I'm gonna auscultate the heart. So I will say the patient that stay very, very be quiet and that breathe normal, that doesn't interrupt the examination. So relax. Then the stomach. First, I will auscultate. So I will say maybe that still quiet, don't moving. That I have to listen the stomach, and maybe if the patient move, will make some noises that may make me feel or make me hear that something is not normal, and maybe that sound is only produced by the movement by the patient. Then I'm gonna palpate the stomach. So I have to ask to the patient if, while I am palpating, please tell me if if somewhere pain while I am touching. Mm, then the legs, maybe I will check the nervous system. So I'm gonna check some reflex. So I will ask to the patient that up one leg, up the other leg, and flex the knee. Or try to bring the leg to the chest. Then I will make some tests to check the nervous system while the patient maintain, keep, maintain the leg up.
Use both.
Mm-hmm. And finally, I will check, I think, the feet. So the patient have to be the patient doesn't have to move while I am checking the feet, the feeling, the sensation, if maybe he or she has some numbness. And I think that's all.
Okay, that's pretty good. Well, I know we have to use some ways to make our patients understand in an easy way, right? But if you want to say, like we usually use the cúbito dorsal, right?
Uh-huh.
It's like dorsal decubitus, just that,
Okay.
okay? But
Okay.
you can say lay down on the bed with your face up, watching on the floor, maybe
Mhm.
some kind of that. Okay,
Okay.
thank you. So I want you to think of an examination in maybe an accident, a frequently accident you always carry out with.
Okay, the first instruction to the patient will be, please don't move. I have to check you because you have an accident and maybe you can have some fractures. So you definitely don't have to move. I'm gonna check you. I'm gonna touch your bones, your neck, your head, and if you feel any pain, please try to don't move because you can get worse if you move.
Mm-hmm.
Then to my team, I'm gonna say instructions step by step. Maybe start with the head. I'm gonna palpate the neck. I think the most basic examination in with a patient that had an accident, I can do alone. But
Mm-hmm.
when I have to examine the vertebral column, it's okay.
Yeah, that's good.
Yeah, I need two more people. So
Okay.
I'm gonna say that we have to roll on the patient
Mm-hmm.
to one side, and while they maintain the patient in that position, I'm gonna examine the vertebral column. No, I need
Fine.
three. I need
You can
three
use
more people.
spine for I'm so sorry, I cut you down. You can use a spine instead of a vertebral column.
Spine,
Okay.
vertebral spine, or
Mm-hmm.
just
Just a spine.
Yeah, just the spine. Thank you.
And you can use the cervical vertebral cervical bones with.
Cervical vertebra spine. Okay, thank you. So the instruction to my with my team will be I need one people to keep the head um, very try to don't move the head. I need another people that be in the part of shoulders in the patient's shoulders, and I need another people that have to move the part of the legs and the hip. So the person that is in the head have to put the hands, one to in the ear, then the right ear, another in the left ear, and then keep the hands and don't move. And then the second person have to put one hand in the shoulder
Mm-hmm.
and the other hand in the hip, the patient's hip. And the third person have to cross the hand with the other colleague in the patient's hips. So like this.
Yeah, I'm
And
just imagining all of uh, things you're saying. Okay, that's pretty good because I understand.
and then the other hand has to be in the patient's legs.
Okay,
Let me
so
check.
you need a lot of people to do that.
Yes,
Wow.
we have to be four
Yeah.
with me. Um, Let me check and a pic that I want to show you the movement.
Okay. Um, while you're doing that, I'm gonna make clear that vertebra, it is like the same vertebra. Okay, cervical vertebra, and
Cervical
you can
vertebra. Okay.
write it down like vertebrae. Okay,
Okay.
but you can say spine for columna vertebral. Spine.
Spine is the same. Yeah, that's true. Let me check. I don't find the imagine, but what? More or less that we have to be one in the head, two
Mhm.
people with the body, and I
Like
have to
this,
be
like
like this.
this, and the other one like this here, and on the hips.
Uh-huh.
Yeah, and the other one crossing hands with the
The
one that
other
is here.
colleague.
Okay, and you on his legs, right?
Yeah, well, this is the other colleague. I have to be with the hands free.
You're just saying what they have to do
Yes,
and what
yes. And then when all have the position, I have to say them that I'm gonna count until three. And when I say three, the both person that are in the body have
Mhm.
to roll the patient to the right side, for example.
Okay.
And the person who has the head has to roll on with them at the same time. And then I count one, two, and three. And in the number three, I gonna check the spine.
Wow.
And then when I finish that, I'm gonna count until three again. And when I say three, the patient come to the normal position again.
Wow. Okay, it sounds pretty much uncomfortable. I don't know. Maybe sometimes I have some friends, some doctors that are my friends, and one of them uh, put me in some position like a chiropractic,
Uh-huh.
and I was like, no, this sounds, no, this sounds. I think I'm gonna die, but it was just the sounds,
Yes. I remember
more or
that
less.
I was in the Red Cross
Hmm.
a long years ago, And when was practicing this, I remember that I was in the head or not. Yes, I was in the head. I was maintain the head, and when the instructor count, and hi Carlita,
Hey,
each
Carlita.
one
Just a
just
second.
roll to wherever side, who cada persona mantenía su lado, who
Uh-huh.
person maintained her side, and the instructor said us, "Oh no, the patient has died."
Yeah. It sounds like. Okay, Liz, thank you very much. I will send to you my little questionnaire, please,
Okay, teacher, done.
to take a picture. Oh, thank you very much. So, Liz, see you tomorrow then.
Thank you so much, teacher. Take
Goodbye.
care. Good night. Bye, Carlita.
Goodbye. See you.
Mhm.
Goodbye.
Hi, Carlita. How are you? Good
Hi,
afternoon.
teacher. Pretty fine. Everything's doing well here. How
Okay.
are you? Are everything is fine there?
Yeah, here, yes, it's fine. It's not raining,
Okay.
at least. I don't know, in Cochabamba, it was raining yesterday.
I think it's 2 weeks in a row that it's raining every day, so we don't have seen sun like 1 week. Yeah,
That's
it's
weird, right?
yeah, it's really weird here. I don't know. It's maybe the climate change. Maybe.
Yeah, it's
Yeah.
true. I here it was raining a lot, but not like in Sucre. But now it's kind of hot. I don't know. The
Now
sun
you
was
are the
there.
place with hot.
Yeah, it's so crazy. For La Paz, it's so crazy. And you telling me that in Cochabamba it's raining the whole time, and I'm like,
Yeah.
what is
It,
going?
I don't know what's going on.
How about your eyes? How is your sight?
It's getting better. I didn't saw the photopsies like a
Mhm.
week ago, so I'm thinking it was maybe how to say it, a low level of collagen, maybe because I'm taking now collagen and some vitamins that the doctor prescribed. So with that, I'm getting better. So I think it was that. Maybe I was dehydrated or something, and that made very sticky for my jelly to stick to the retina. So I
Yeah, it
think
it can be a problem, right? The
yeah.
hydration. I think sometimes when I'm not drinking a lot of water or something like that, I have a headache. And I didn't notice that it was that. I thought it was my sight, right? But it wasn't.
Yeah, and that's funny because when the most typical headache that we know, it's when someone takes a lot of drinks, right?
Yeah.
The normal thing it's a headache because alcohol dehydrates the body. So people doesn't
Mhm.
know that if they he takes a lot of water, they can repair that headache. So that's a very typical thing that is common in alcoholics. Yeah.
Yeah, but I'm not okay.
I'm not telling that, but I'm talking about the point of being dehydrated.
I'm just a camel. I'm just a camel.
Yeah,
Just
no,
that.
but yeah, yeah,
I just don't drink any kind of water, okay?
yeah, just we have to be hydrated, maybe,
Uh,
especially in high places because like
yeah.
here in valleys we drink eight cups of water per day, but in higher levels we have to drink 12 cups
Oh
a
my
day.
God.
So if
I'm
you are
not
not
even
drinking,
in 3 glasses of water.
oh my
What I'm going to do? Okay, I will take your advice and I will do it.
God.
Thank you,
Yeah.
Carlita.
Don't worry.
Okay, so Now I will put you in a situation as always, okay?
Okay.
And I want you to think of an examination you frequently carry out on your consultation. And maybe you can give some instructions to your patient, okay, for what you want him or her to do in every situation you're asking for.
Okay. Well, let's say about a patient with sore throat that he has a problem with breathing problems.
Okay.
Well, we ask him, well, come in here, please, and you just saw how they come because they come very tired, very sad. So you know that it's a very hard sickness. But if you see them like, well, he's starting something, right? So we see that, we see them, we ask them, hey, how is going, what happened, and they tell us, well, I was having problems for 3 days with coughing, and 2 days ago it started to hurt my throat. I cannot eat. I'm not swallowing right. I feel a lot of hotness, but I'm not sure if it's fever. Maybe they say, uh, well, we ask them, have you eat today? Are you feeling tired? Are you are you sleeping right? Are you coughing with sputus, with phlegms? Are you drinking a lot of water? And well, after the questions or taking the history, right? We make the physical examination. We ask him to lie on the examination table, right?
Yeah.
To the no lie on, just to sit on. Then we say him to tilt a little forward, and we auscultate the lungs, the base of the lungs. We see if we have the vesical murmur that it's normal to hear, but when we have mucus on the lungs, we will hear like um, we will hear,
Palpitation.
oh, no. When we auscultate first.
Okay.
So we heard the vesical murmur that is normal. But if we don't hear that, it's because the lungs are full of mucus. We ask them to say 33. They still tilt forward. So
Mhm.
we ask them to say 33, 33, 33. We see we have the resonance right, and then we see their we ask them, please, can you open your mouth very open, very right, very open, so we see with the
Open wide.
open wide, yes, and we see with the lantern the oh my god, how I say amygdala.
Tonsils.
Tonsils, yes, yes. We see the tonsils. We search for black, white platelets, and if we see that, we with all that parameter, we can say that he is or he is not with pharyngitis, maybe. Or if he has mucus on the lungs and it's very obstructive, we see pneumonia maybe. Yeah,
Okay,
or
that's good.
bronchitis if we
For
hear.
COVID, it seems so much alike.
Yeah, well, oh, you're right. I forgot that I didn't like. I'm not working yet in COVID, so I didn't talk about it. So I have to integrate that to to my cases, right? Well, yeah, we can keep.
Like
We
a
can keep.
differential diagnosis, right?
Yeah, well, actually,
In that
COVID
case,
causes pneumonia. That's pneumonia can be produced for a lot kind of bacteria. So COVID can be one of them. So
right.
yeah, we will discover that later. But it's probably COVID in this moment.
But when you discovered that it's COVID
Yeah.
because of the PCR or maybe with the radiography.
Well, we have both criteria, but the golden test always will be the PCR or the ELISA if we don't have PCR. But yeah, the gold standard always will be PCR. But
Okay.
in these cases, if you see someone with all these typical characteristic symptoms, you say COVID, and maybe they who don't have the money, 900 Bolivianos, so we
Yeah.
like that, so we cannot ask them. Yeah.
Yeah, that's right. And I don't know if I asked you before, but I heard a lot of ivermectina on those days. So I want you to tell me if it works or not, because I think it's not working, and maybe people is using like a preventive uh,
Mm,
thing.
how can I say it? Are studies that prove that it works. So what lately I heard is that it has some impact in the acute COVID and moderate, but doesn't work as well in severe in when they have intensive care treatment,
Yeah, I know, but
but not preventive.
okay, but people think that they have to take the pills two for once every 15 days, just like a preventive treatment.
No,
I heard that, and I was like, what are you doing?
no,
But I want
yeah.
to know. I'm sorry, I'm just closing the idea. Okay, I want to know if this treatment, okay, will diminish the viral count, or what is the relevance for this treatment?
Well, the ivermectina doesn't work like that. It's more like it won't reduce the amount of COVID,
Mhm.
but it won't make it replicate.
Hmm?
So it will stand in um, very low amount. And when we have a low amount of coronavirus, we have the less risk to damage more organs
Okay.
or more tissue. So that's the question, right? So if we have an amount, a small amount, we don't have a risk. We have it, but we don't have a big amount.
Okay.
So it works like that. And I'm not sure, right? Because everybody's talking about all antibiotics, but we cannot discover yet what is working because they are giving ivermectina and they are giving azithromycin, they are giving all dexamethasonas, they are giving all kind of treatments together. So how we can discover that it's one thing that is working? And we cannot ethically stop giving them the treatment. We
Yeah.
cannot just giving them. You just will take ivermectina, and if doesn't work, you will die. So ethically, we are with hands tied because we cannot do too much research about it. So when
Yeah,
all these things
and
have
I
passed, maybe we have the chance to discover correctly what is the best
right,
treatment.
but I agree with you when you are talking about ethically things because some people mm, I heard too about this dentist in Beni that was giving them a lot of treatment, right? A lot of
Yeah.
pills and everything. I don't know what he was doing, but people recovered because of that, or maybe because they believe in that. I don't know, but it was just like some people told him, "No, what are you doing? You're gonna kill them. You're the worst one. You don't have to. You don't deserve to be a
Yeah.
part of the health service or something like that." And maybe you don't know. You're not doing nothing for that people, and maybe this man is doing something. And thank God he helped some people.
Yeah, well, actually, it's because the 80% of people will recover without treatment. They don't have symptoms, but they think if they take ivermectina and azithromycin and everything, they will get better. But it's actually the statistically they will recover. So it's not even if we don't give them paracetamol or nothing, they will recover
Mhm.
because but just we have the 20% that gets a little bit worse, and of that 20%, 5% will go to a severe degree COVID. So that's why what we have to look. If we have a treatment that reduce that amount of people, so that's how we can discover that that treatment was well. And if we don't do research, we won't find out any, because we can say they are part of the people that will recover without anything. So
Yes,
that's yeah, that's why we have to do a lot of research here in Bolivia.
that would be the best thing that we can do, but everyone is just taking part of his mind, maybe, and not showing documents and studies, right? So,
Exactly.
what we can do. Okay, just a little question about the things we are talking about.
Okay.
Okay. Um, can you describe a psychiatric case you have encountered in your professional career?
I see cartridge. Whoa. Well, I had a lot.
Yeah, one of
well,
those.
Well, I have find the latest one and the most common one is the alimentary diseases, maybe
Yeah, or
bulimia,
nutrition, right?
nutritional diseases. Yeah, I had a lot of cases of, especially in adolescents, of bulimia, anorexic, and you can actually discover when the patient is an income patient, because they don't eat anything when you give them, and you ask their parents if they eat well at home, and they typically say that no, they eat just a little bit, but they usually eat like that, but they don't worry because they look it like normal for his child. So
Mhm.
it's very typical and it's a worry, right?
Yeah.
That's the most common thing I saw, and it's sad because it's like 50% of girls from 14 to 16 that they come like that, and we are working like a health service promoting healthness, right?
Yeah.
Because it's not a priority in our country. We have worse problems, right? But these problems can be a problem forward, because they won't develop as good as a normal child. If we don't heal anorexia, bulimia in adolescence, it can be permanent. It can turn to a lifestyle. So yeah, that's what I want to research more here in Bolivia, because there we don't have too many health centers that work with that. I think we have one in Santa Cruz,
Mhm.
but parents doesn't want to go to that places because they are a little bit not cheap. They are a little bit expensive because it's a specific treatment, right?
Yeah, that's so interesting what you're saying to me, because I work in a foundation that are trying to help people with nutrition problems, and we are trying to manage all the things we have in our hands to help people with education, with controls, with medical help, and everything we can do. And that's why I was telling you that we're working for donations and some things like that. It's true what you're saying. Nobody these kind of problems because all of us has the same problem, even though we are not bulimics or with anorexia, but we have another kind of problems, right? We don't eat well,
Exactly.
and we have to.
Bolivians eat a lot of carbohydrates.
Yeah,
Yeah.
that's right. And thank
Yeah,
God we are not like this big, right?
exactly. So yeah, we have to improve a lot the nutritional part on parents because they don't know what to give them, and that's a reality. People, the parents say, "I will give them what my parents gave me," but that wasn't just right, right? And so we have to do a lot of work yet.
A lot of consciousness. That's right.
Yeah.
Okay, Carlita, it was a thank you very much. I will send to you my little questionnaire, okay?
Okay.
And I will take a picture.
Okay.
Uh-oh. Oh,
It closed.
you. It was a little bit slow. Thank you. Okay. So see you tomorrow
Thank you,
for the
teacher. See
next
you
class.
tomorrow.
Thank you. See you, Carlita. Take